Urology is the perfect blend of medicine and surgery. Not only do you get to take care of patients over many years, you also get to be at the forefront of surgical innovation, doing robotic surgery, single port surgery, and so much more. We're also a group of individuals who I think are really wonderful people, funny, and great to work with.
One of the reasons I went into allergy immunology is that I actually get to see both kids and adults for all things related to allergy, and I love that.
Pediatrics, in my humble opinion, is the most fascinating branch of medicine, and also children are the population I wanted to defend, advocate for, and do everything in my power to protect.
I originally went into my specialty because there was such a link between gut health and the immune system, and I was so mesmerized by the nutritional effects on the immune system and its effect on gut health. I also knew that I wanted to do something outside the traditional path in medicine, and I thought that having a background in immunology would give me the opportunity to create my own path.
I chose the field breast surgical oncology because it was the most evidence-based field in general surgery, and I wanted to go into a field where the national standards of practice were all the same.
So I went into the field of pediatric critical care because it was fast-paced, exciting. There was a combination of combining sort of intellectual medical mysteries with really instinctual medicine, and then obviously the procedures are super fun. And honestly, I really love being in sort of intense patient and family relationships. I really feel like it's a privilege to be with families during their most difficult of times.
I chose breast imaging radiology because breast cancer is a disease that, when caught early, is curable. As a breast imaging radiologist, I detect and diagnose breast cancer and have the opportunity to save women's lives every single day.
I went into internal medicine because I love knowing a little bit about everything. Furthermore, in outpatient medicine, I get to develop a long-term relationship with all of my patients.
I went into urology because the second I walked into the operating room and saw the personalities and the smiles and just the positive atmosphere from the surgeons, the urologists, the residents, and the team that worked with them as well, seeing something like the robot, which back then was something new, and seeing how urologists are on the forefront of using technology, and finding out that as urologists, you don't just operate. You can manage a majority of the problems that deal with the urologic organs in the office with medical management.
Gastroenterology is a great field that allows you to be cerebral and procedural. You can think in depth about curing liver diseases and all its complications, and be able to take out colon polyps all in the same day. It's a great work-life balance, and there's a need for men and women. Women especially have a great advantage in this field because there's not as many of us as there are men, and female patients always prefer female doctors.
I chose gastroenterology because of my father, who died of colon cancer. I firmly believe that with healthy lifestyle and appropriate screening, we can reduce the risk of colon cancer. I really loved surgery. I didn't think I was gonna love surgery. In fact, I thought I was gonna go into primary care. But my very first surgical rotation was trauma surgery, and I just fell in love. I loved the big open surgery, and I love that immediate gratification of being able to fix someone.
I decided to become a psychiatrist because I fell in love with psychiatry on my psych rotation as a med student. I loved talking to patients about what was going on in their minds and kind of behind the scenes. I really enjoyed helping patients explore their thoughts and feelings and understanding the lens through which they viewed the world.
I was exposed to the field of reproductive endocrine at a very early age, suffering from PCOS or polycystic ovarian syndrome myself. I always knew I wanted to go into this and kind of help change the world.
I chose ophthalmology because of the wonderful mix of medicine and surgery, and I could think of no better way to impact a patient's life than improving their vision.
I chose facial plastic surgery as my career because it's the perfect marriage of art and science for me. I knew I always wanted to go into surgery, and I loved very meticulous surgeries, and I liked the ability to be able to perform surgery from a very artistic perspective, and so this field really allows me to do that. And on top of that, I love having the ability to allow people to look and feel their best. It's just a very gratifying feeling for me, and I'm happy to be able to do that every day.
So the 3 reasons I chose ophthalmology: 1, I love being outpatient medicine, not a huge fan of the hospital. Number 2, tons of potential for global work and doing work internationally. I've traveled to Mexico and I've traveled to India doing surgeries in both locations on volunteer missions. And number 3 is I love being an expert in one area. I love being able to diagnose and treat and sort of know everything about the eye, very, very specialized in one area.
What I love most about palliative care is the whole person and family approach to care, taking into account the physical, the emotional, the psychosocial, and the spiritual aspects that make up the person, while the main goal being improving their quality of life.